Savannah, and I'm going to be doing chest tube drainage system care today. First thing I would do is gather my supplies into the patient's room, providing privacy behind me. I would introduce myself to the patient. Hi, my name is Savannah, and I'm going to be doing your chest tube care today. Can you tell me your full name and date of birth? So I would identify my patient using two forms of identification and confirming it with their wristband. I then would perform proper hand hygiene and apply any PPE. I would then explain to my patient what we're going to be doing today. So today I'm going to be changing your chest tube drainage system. And then I would assess my patient for any pain on a scale of 0 to 10. If my patient had any pain, I would administer pain medication and then come back. So the first thing I'm going to do for the chest drainage system is to inspect the site, making sure to keep the patient covered. So you're going to assess the padding over the tubing. You assess for the any drainage or making sure that it's dry and inclusive. And then I'm going to follow the tubing down, making sure that there's no kinks. And just for demonstration purposes, I'm going to bring this up here. Normally it would stay below the level of the insertion site. So after checking the tubing for kinks, I'm assessing the collection chamber for the amount, type, color of fluid that's coming from my patient. After that, I would be checking my leak monitor to make sure that it's at 2 centimeters or my manufacturer's request. And then this right here is the water seal chamber. So you want to see with inspiration and exhalation that fluid level moving up and down. If this wasn't at 2 centimeters, I would disconnect my tubing, making sure to keep it sterile, and I would fill it with sterile water to the 2 centimeters. So that's how I would assess my chest drainage system. If I was to change my drainage system, I would do the same thing. I would identify my patient and explain my procedure. I would also gather my equipment, which is Kelly clamps, sterile water, and a new drainage system. I would also remove my gloves and perform proper hand hygiene again. When changing the drainage system, you want to make sure that you use the Kelly clamps and put them 1.5 to 2.5 inches from the insertion site. And you want to make sure that you put them 1 inch apart in separate directions. With that, you would remove the suction, and then you would remove the tubing from the drainage system, putting it in sterile water. When you change out the draining system, you would reconnect the tubing to the collection chamber, and then you would remove your Kelly clamps and resuction. When you're removing the tube, you want to make sure that you're twisting and not pulling the patient's tube from the insertion site. And then when you reconnect the drainage system, you just want to reassess the same things that you did. You want to check the insertion site, making sure that it's dry and intact, and you also want to feel the insertion site for any crepitus, subcutaneous epidema, and you want to that would feel like popping under the skin. When you're reassessing the changing of the drainage system, again, you're going to assess that you have the 2 centimeters in your water seal, filling that with sterile water when you set it up again. And you want to make sure that your fluid level is moving with inspiration and exhalation, and that your drainage is draining properly. At that time, you would remove your PPE and make your patient comfortable, making sure to put the side rails up and give them their call light if needed. I would remove my gloves in the end and just perform proper hand hygiene. And that concludes my video.